20 seconds hand hygiene. Hello, Mr. James. How are you doing? My name is Fernando. I'm going to be your student nurse today. I'm going to be doing some tracheostomy care for you today. And I understand that you can't speak, so I want to establish a sense of communication before we continue with the procedure, okay? All right, so I'm going to be asking you some questions throughout the procedure. If you want to answer yes, please hold your thumb up. If you want to answer no, please hold your thumb down. And if you feel any pain or discomfort during the procedure, please just raise your hand, okay? All right, so let's go ahead and practice. So I'm going to check the wristband. Is your name LeBron James? Thumb up, okay. Is your date of birth December 30th, 1984? Thumb up, okay. And I don't see an allergy wristband. Are you allergic to anything? Thumb down, okay. And have you ever had this procedure done to you before? Thumb up, okay. So you know what to expect, but I'm going to go ahead and explain the procedure to you anyway. So I'm going to listen to the upper airway, your lungs, to assess for any mucus or secretions, and if there is present, which is more than likely, we're going to go in and suction through that trach or inner cannula that you have in your throat. And after we're done suctioning, getting all the gunk out, we're going to go ahead and replace that inner cannula with a new one. And then we're going to remove that old dressing. We're going to clean around the area and the surrounding skin, and then to reduce a risk of an infection, and then we're going to replace it with a new dressing, okay? And then afterwards, I'm going to grab another nurse, so I'll be gone momentarily, and then they'll help me replace that blue trach stabilizer that you have on your neck, okay? All right, sound good? Thumb up, okay. So I'm looking at your vital signs. I see that they're within defined limits. The only thing is your respiratory rate is at 26, which is a little high, and your oxygen saturation is at 91%, which is a little on the lower end. It's nothing too urgent, but we want to make sure those saturation levels are at a good level before we go in and suction, okay? So we're going to have to go in and perform hyperoxygenation, which is just giving you more oxygen to make sure those saturation levels are up to speed, okay? And then, due to your vital signs, I noticed that you're having difficulty breathing and shortness of breath. Is this true? Thumb up, okay? All right. And then when you had this procedure done in the past, did you have any pain or discomfort with it? Thumb down, no, okay. And then did you tolerated it well? Thumb up, okay. So do you have any questions or concerns about anything? Thumb down, okay. All right, so I'm just going to go ahead and lower your gown a little bit to take a better listen at your lungs, okay? I'm going to listen 4 times, and I'm just going to need you to take a deep breath each time, okay? Deep breath in, deep breath out. 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 All right. So yeah, so I do hear some mucus and secretions. So, no need to worry. We're going to go ahead and take care of that, all right? Alrighty. I'm going to get those airways cleared up and have you breathing better. So do 20 seconds of hand hygiene. So I'm just going to go ahead and get my desk ready and clean, all right? Alrighty. Alrighty. 20 seconds hand hygiene, new pair of gloves. I'm going to grab my sandy wipe. And I'm going to clean for 30 seconds, making sure to get every inch. And then I'm going to let it dry for 2 minutes. So, Mr. James, is your wife coming today? Thumb up. That's fantastic. Always good to have the wife around. Yeah, it'll calm your nerves, keep you company. That's good to hear. I'm glad. All right. So then, go ahead and dispose of this. And I'm going to let that dry for 2 minutes. While I'm letting it dry, do 20 seconds hand hygiene. Then I'm going to raise the bed at high Fowler so it's easier for me to work with. And then while the table's dry, I'm going to check that I have all my bedside emergency equipment. So I have my ambu bag attached to 15 liters of 100% oxygen. I have my suction catheter attached to the suction running at 120 millimeters per mercury. I have 2 trachs off to the side, one the same size the patient has it in, and one smaller than the size the patient has in. And I also have an extra inner cannula off to the side. Okay. All right, so now I'm gonna go ahead and do 20 seconds of hand hygiene now that I've ensured I have all my emergency equipment. The suction's working well, oxygen's hooked up. Now I'm gonna start putting my supplies down on the table because it's been drying for 2 minutes now. So now it should be okay to put my stuff down. Okay. So I have my sterile saline water here. I have my inner cannula. I have my trach stabilizer. I have my suction catheter kit, and I have my trach care kit here. And then I'm gonna go ahead and change the suction catheter because I'm not sure when the last time was that they changed it. Go ahead and take this out. We're going to use this later. Okay, and then I also have my sterile saline box here with me. I'm going to shape. Now I'm going to get my trach care kit ready. Okay. I'm going to open it, making sure not to touch the inside. Alright, and then I'm just going to get rid of anything I don't need. So I don't need this. Then I'm going to grab the sterile drape, making sure to only touch the outer 1 inch. Alright. And then we're going to make sure to not cross our arms. Make sure the glossy side is down. Again, touching the outer 1 inch. There you go. Glossy side down. And then I'm going to go ahead and pour sterile saline water to halfway. And then filling the box up halfway as well. I'm closing that. And then we're going to drop our inner cannula in now. Making sure it doesn't touch the outside of the box. Alright. And I'm just going to adjust it, making sure not to touch the sterile part. To adjust it for later. Alright. So now everything's set up. So I'm going to go ahead and change my gloves because we've been touching a lot of things. Do 20 seconds of hand hygiene. Put on a new pair of gloves. Alright, now we're going to move on to the hyperoxygenation, okay? Alright, are you ready, Mr. James? Thumb up? Okay. Just let me know if you feel any pain or discomfort, okay? Alright, and then I'm just going to test if the MB bag's working. It is. Okay, and then I'm also going to take this off. And then, okay, we're going to give 3 breaths, okay? You ready, Mr. James? Thumb up, okay. Hold the faceplate. Going to give 3 breaths. 2, 3, 4, 5, 6. 2, 3, 4, 5, 6. 2, 3, 4, 5, 6. Alright, so we're going to go ahead and put that back. Was it, Mr. James, doing good? Thumb up. Okay. You feel like you're breathing better? Oxygen saturation has improved. It's at 98% now, so that's good. Now we're going to go ahead and start suctioning, okay? So when I go in, you might feel a little cough, but, you know, it shouldn't last more than 10 seconds, okay? So I'm just going to test my suction, make sure it's working. Okay, it's working. So I'm going to go ahead and go in. So I'm going to expose the tip a little bit, making sure to only touch the inside. And then I'm going to advance. Alright, suction. 5, 6. Alright. How was that, Mr. James? Good? Thumb up. Any pain? Thumb down. Okay, you did a fantastic job. And then I'm just going to go ahead and cover this again. Alright. Do your airways feel clearer? Thumb up. Okay, that's good. Alright, and then if I need to suction again, I would wait 30 more seconds. Alright, and then I'll dispose of this. And then I'm going to do 20 seconds hand hygiene. Alright. Now we're going to start changing that inner cannula and the dressing. Alright, so, alright, Mr. James, like I said again, if you have any pain or discomfort, please raise your hand, okay? Alright, so we're going to remove this, and then we're going to hold the face shield dispose of this. And then we're going to grab the new inner cannula, making sure not to touch the sterile part. Alright. And making sure to clamp it with the butterfly clips. Okay. How is that, Mr. James? Good? Thumb up? Alright, good. Now I'm going to remove this dressing. Alright, so now I'm going to assess the site. I don't see any cracked early tubing. I don't see any redness, swelling, any signs of infection, any pressure sores. Don't see any signs of irritation or infection. And I'm also going to assess for any respiratory distress. So don't see any retractions, don't see any change in mental status, any nasal flaring, or any change in skin color, okay? Alright, so now we're going to go ahead and clean the area. So I'm going to dip the swabs in sterile saline. Swipe once, dispose. Dip it in sterile saline. Swipe once, dispose. Now we're going to dip the dressing in sterile saline. Dip. Alright. And then we're going to clean the top of it as well. Alright. And then we're going to dip it in sterile saline again, making sure to clean the edges of the face shield. And then now we're going to pat it dry. Alright, here we go. And now we're going to apply the new dressing. There we go. Try to pull this up. Alright, there we go. Making sure I'm stabilizing the face shield. Alright. There we are. Okay. How was that, Mr. James? Thumb up? Alright, and then I'm gonna just put this back on. Alright. Any pain or discomfort during that? No? Alright. So the oxygen saturation levels are good. Did you tolerate that well, Mr. James? Thumb up, okay. Patient tolerated it well, denied any pain. Are your airways clear now, Mr. James? Thumb up, okay. And, no pain as well, right? Okay, thumb down. I didn't see any redness, swelling, infection, and the procedure was good. So I'm going to go ahead and get my other nurse so we can take off that trach stabilizer and replace it with the new one, okay? Alrighty, so I'm going to put the bed at the lowest level, side rails up, call bell and reach. Let me know if you need anything, okay? Any questions or concerns for me? Thumb down, okay? Alrighty. And then the respiratory effort was improved as well. So I'm gonna go ahead and just pick my area up. And then I'm gonna leave the trach stabilizer because we're gonna bring it later on. Okay, and then I'm going to do 20 seconds hand hygiene. And I'm going to dispose of this in the right receptacle. All right, Mr. James, I'll be right back. And close the door. Hello, Mr. James. I'm back. I brought my friend here, Joe. He's going to help me remove that trach stabilizer around your neck, okay? I'm going to do 20 seconds of hand hygiene. And then, do you remember our way of communicating? Thumb up, okay? And then I'm just going to check the wristband. Is your name LeBron James? Thumb up, okay? And is your date of birth December 30th, 1984? Thumb up, okay? And then I'm going to raise the patient to high Fowler's. Then I'm just going to go ahead and do hand hygiene again. And then we're going to go ahead and start with the procedure, okay? Mr. James, okay, thumb up. Then we're going to go ahead and put our gloves on. gonna go ahead and take this off. And then can you hold the faceplate for me, Joe? Thank you. I'm gonna assess the neck for any redness, swelling, any pressure wounds, any signs of any irritation and infection, which I don't see any. And then while you're removing it, do you see any redness, swelling, any signs of infection, any pressure wounds, any signs of irritation?
No.
Okay. Alright, fantastic. And then we're just gonna check the size for 2 fingers. Do that, Joe. Alright, so we got it's the correct size. And does that feel comfortable for you, Mr. James? Thumb up. Alright, and then we're just gonna put the oxygen mask back on. Alright, fantastic job, Mr. James. So, I'm gonna do hand hygiene and take a look at the vitals. I see the oxygen saturation is at 98%. The respiratory rate now is at 18 breaths per minute. And I'm just gonna take a quick listen to your lungs, okay, Mr. James? Alright, so I'm just gonna lower you down. Deep breath in, deep breath out. Deep breath in, deep breath out. Alright. So yeah, I don't seem to hear any secretions or mucus in the upper airways, which means the airways are clear now. And now I'm just going to do hand hygiene again. So yeah, the lungs were equal and clear bilaterally. So Mr. James, did you feel any pain? Do you feel any pain right now? Thumb down, okay. And you tolerated the procedure well? Thumb up, okay. And do you have any difficulty breathing or shortness of breath right now? Thumb down, okay. And then I just want to make sure the ambu bag is still connected to 15 liters at 100% oxygen. The suction catheter is still connected to the suction, although there would need to be a replacement of the suction catheter. And then the trach is still in the same place, and the oxygen mask is still connected to 6 liters of 100% oxygen. All right, so I'm gonna go ahead and put the side rails up, call bell and reach, and then I'm gonna put the patient at the lowest position, the bed at the lowest position. And do you have any questions or concerns for me, Mr. James? Thumb down, okay. All right, Mr. James, fantastic job, thank you. So I'm gonna go ahead and clean up my area, dispose of it, and then do 20 seconds hand hygiene. And then I'll leave the room and then close the door. So then I'll go ahead and document that the date and time of the procedure, how the patient tolerated the procedure. They tolerated it well. There was no redness, swelling, any signs of infection or irritation at the trach site. And there was no signs of infection or irritation or pressure wounds in the neck, in the back of the neck. I also would record the sputum color, amount, and consistency. I would record that the oxygen saturation and respiratory rate were at 91% and 26 prior to the procedure, but they have improved to 98% and 18 breaths per minute. The patient denied any pain, and I would also report that there were secretions and mucus heard in the lungs bilaterally, but now they're clear and equal bilaterally after the procedure. And I would also report that the patient denies any shortness of breath or difficulty breathing. And that is it. Thank you.